This video is going to offer a quick overview of the heart, the cardiac cycle, ECGs, and this video is intended for those other than, say, allied health majors. I teach anatomy and physiology, and I have many videos which go into these details, these topics in greater detail. This is just meant to be an overview for, say, a non-major, or for those who are, looking at health results for themselves, for loved ones, and just trying to get a basic background in terminology and some basic principles. So the heart is constantly moving, and it would develop blisters if it weren't for the fact that it was wrapped in one of the serous membranes in our body. This one is called the pericardium, but we see a similar development with the lungs, with the digestive tract, that we have these double membrane bags which line body cavities, and between the two smooth membranes there is a space. So between the layers of the pericardium there is a pericardial cavity that has a lubricating pericardial fluid, which then allows the heart to continue to beat and to move without developing blisters and adhesions. The heart is roughly triangular in shape, but an upside down triangle, so that what we would refer to as the base of the heart is, around here, where the second intercostal space is, the space beneath the second ribs. And the tip is around the fifth intercostal space where the ribs come together, but a couple of inches to the left of the midline. So 2/3 of the heart is to the left. It angles a bit. As we will see, there are two different types of chambers in the heart. There are atria, and then there are the larger ventricles. The atria are near the base of the heart, and the ventricles make up most of the heart, going towards the apex of the heart. And one can even see this on the outside, because there are grooves where one can notice where chambers meet each other, either atrioventricular grooves near the base or interventricular sulci where the ventricles separate. And we have blood vessels here. And when I talk about heart disease in the upcoming video, it is clots and blockages in these blood vessels of the heart, which then can lead to the death of muscle tissue and cause a heart attack. So these blood vessels which lie in these grooves are very important. There are three different kinds of muscle in the body. There's skeletal muscle, which we have voluntary control over, and this allows us to move. We have smooth muscle, which lines blood vessels in our digestive tract. But cardiac muscle is only found in the heart. And it has both anatomical specialization, so that cells don't rip apart from each other. But also, when it contracts for prolonged length of time. That makes it different from skeletal muscle, and that's important in how the heart functions. Now, to really understand anything about the heart, one has to have some sort of an idea of how blood flows through the heart. And now, because this is such an important concept, it keeps coming up again. And so, if I were to go through this once and, you weren't, 100% on the pathway, it, is repeated multiple times. And so, as you will see, the heart is not, working as a unit, but rather than two units. Part of it will be pumping blood to the lungs and back. Part of it will be pumping blood to the body's systems and back, as we will see. Here you'll see color differences between the two types of blood, because when hemoglobin of the red blood cells binds oxygen, it does become a redder color, while when it is more. So as I trace the pathway of blood through the heart, we'll be talking about the chambers. And inside the heart, notice that there are spaces. This is where the blood goes. And notice that these chambers vary in their size. The atria near the top are small, near the base. And the ventricles are larger, but the width of the wall can vary. So notice how thick this wall is compared to that wall. notice that only one of the chambers, the left ventricle, makes up the apex of the heart. So I'll explain that in just a minute. Then also there are layers of the heart, a smooth outer epicardium, a smooth inner endocardium, but the muscle, which is contracting to generate, blood pressure, pumping blood to the brain and back, hands and back, etc. That is in this layer here, the myocardium, myo being the prefix for muscle. And so right now there is blood in your body, which has delivered oxygen to your brain, your hand, your foot, etc. After delivering the oxygen, it then becomes deoxygenated blood, which is that purplish blue color. This collects in veins, which returns to one chamber and one chamber only, the right atrium. So the right atrium gets, the bluish purplish blood that the rest of the body systems are done with, because they've used the oxygen. From the right atrium, blood is sent to the ventricle, that's the large chamber beneath the right atrium. And then the right ventricle squeezes and sends blood from the heart. Now, it's leaving the heart, but it does not go back to the brain, the hands, the foot, because these body parts just got rid of this blood. It doesn't have oxygen. They don't want it. They would like red oxygenated blood. And so if we want to turn this blue deoxygenated blood into red oxygenated blood, there's only one body part which can do that, the lungs. And so blood is sent to the lungs, and here gas exchange occurs that I'll talk about in greater detail with the respiratory system. And so oxygen enters the blood, and it now becomes this red oxygenated blood, which returns to the left atrium. So the left atrium is receiving the red oxygenated blood from the lungs. The left atrium sends blood to the left ventricle, and then the left ventricle with its red oxygenated blood then squeezes this, and as the blood shoots through the aorta, it can now go to the brain and back, the hand and back, the foot and back, the body systems, and deliver the red oxygenated blood that these cells need. And as we look at then the heart, we'll see that the atria have the thinnest walls. They don't have a lot of work to do. They are just sending blood to the ventricles underneath them. The ventricles are pumping blood away from the heart, so they have to generate more pressure. But the right ventricle is only sending blood to the lungs, so this is not as difficult, while the left ventricle is sending blood all throughout the body and back the body systems. And so the left ventricle then has a thicker wall. Now, you may then have noticed that there are two what are called circuits in the blood, in the heart. So the heart has two halves, a left half and a right half. Half of the heart is sending blood to the lungs and back. This is called the pulmonary circuit. So note, the right ventricle, when it squeezes, blood goes to the lungs and back. And this loop is called the pulmonary circuit, sending blood to the lungs and back. In this loop, the blood that's in the arteries, the pulmonary arteries, that's the blue deoxygenated blood, while the blood that's coming back through the pulmonary veins is red and oxygenated. So the right ventricle pumps blood to the lungs and back as part of the pulmonary circuit. In contrast, the left ventricle is pumping red oxygenated blood to the body's systems and back. So the brain, the digestive system, the urinary system, the muscular system, etc. And in this systemic circuit, it is the arteries that have the red oxygenated blood and the veins which have the blue deoxygenated blood. And so the heart is doing two separate things. It is pumping blood to the lungs and back so that blue deoxygenated blood can become oxygenated. This is what is called the pulmonary circuit. And the right ventricle is the pump of this pulmonary circuit. And then the heart is pumping blood to the body's systems and back. this then is what's known as the systemic circuit, where red oxygenated blood brings oxygen to the body's tissues. Now, one of the important things that people should know about the heart, if you're going to, ever be, whether yourself or a loved one, interpreting ECGs, and some basic exams, is just, how the heart functions with its valves and then with the electrical fiber. There are valves in the heart. The reason there are valves in the heart is because that pathway, which I had just covered, there's an appropriate way for the blood to go from the atria into the ventricles, and from the ventricles into the vessels, which then leave the heart. That's the right way for blood to go. However, in the cardiac cycle, since blood simply goes from an area of high pressure to low, there are moments where blood pressure would push blood in an inappropriate direction. So it would tend to go backwards if it was only pressure which was determining this. So we want to stop blood from going the wrong way and ensure that it only goes the right way. And this is where the valves come into play. So we have 4 valves in the heart, and their job is to stop blood from going the wrong way. 2 of the valves separate an atrium from a ventricle. So here's the right atrium, the right ventricle, the left atrium, the left ventricle. 2 valves separate atria from ventricles. These are known as atrioventricular valves, or AV valves. They're easy to identify because they have these rope-like chordae tendinonae attaching to them. The right AV valve, which separates the right atrium and right ventricle, that has 3 cusps and is also known as the tricuspid. So tricuspid and right AV valve, those are the same thing, while the one on the left side has 2 cusps. It is the bicuspid, also known as the mitral valve. So mitral valve, bicuspid, and left AV valve all refer to the same valve. The semilunar valves do not have those chordae tendinonae, and they do not have an atrium above them. Instead, they separate the ventricle from the vessels which leave the ventricle. So the pulmonary semilunar valve separates the right ventricle from the pulmonary trunk. The aortic semilunar valve separates the left ventricle from the aorta. So getting to the electrical aspect of the heart, our bodies do run on electricity, so that, when we think, there are electrical messages known as action potentials, which are going over nerve cells, and when our muscles contract, electrical messages go over the muscles. And so the fact that there's electricity associated with the heart is what we would expect, since the heart is primarily muscle, the cardiac muscle of the myocardium. Now, while the nervous system can send messages for muscles to contract, the heart is interesting in that it has some specialized muscle cells which actually start action potentials on their own, all by themselves. And so together, these areas are known as the intrinsic conduction system of the heart. So in a sense, the heart is capable of beating on its own. Now, in the body, the nervous system does, help. It may say, hey, you're exercising now, you need to speed up, or you're at rest, you could slow down. So it can modify the rhythm of the heart, but the heart generates its own rhythm. And so there are these areas, such as this first one, the SA node, which will then go to action potential on its own. Because this is the fastest of these areas, this SA node that's in the wall of the right atrium. It is called the primary pacemaker, okay? Because all of the other areas will then follow it. So a new heartbeat begins when the SA node says that it does. From the SA node, the message gets to the atrium, but it then pauses here at the AV node. And that's important because in the cardiac cycle, because the atria have already been told that there is a new cardiac cycle. The atria will contract first, then the ventricles. The atria, then the ventricles. The AV node will then pass the message to an AV bundle, to right and left bundle branches, and to then these Purkinje fibers. And so this is what's known as the intrinsic conduction system of the heart. It is this area which then establishes the heart's rhythm and then transmit messages throughout the myocardium of the heart. Now, it's important that only those areas be involved. If ever one were to have another part of the heart trying to contribute extra beats, that's what's known as an ectopic focus of a heartbeat, that's bad. So someone might go to the doctor and ask, why do I have 180 beats per minute? That's really high. And the answer is not that the SA node, the primary pacemaker, has made that decision, but that there's another area contributing extra beats, an ectopic focus of a heartbeat, which would then have to be destroyed. Now, once the muscle of the heart is told that a new heartbeat has begun, then the message is spread. And when muscle undergoes its contraction cycle, there are electrical changes. And if you have electrical leads attached to your body in an ECG, you can then notice this. You say, oh, look, here's a little blip of an electrical change. Let's call that the P wave. Here's, an interval, which we call the PQ interval. Here's an odd-shaped blip, which we can call the QRS cycle, going down for Q, up for R, down for S. Here's a segment called the ST segment. Here is this blip called a T wave. And so once the atria and the ventricles, once their muscle gets involved in the cardiac cycle, there are electrical changes, and we can witness that in the what's called the ECG. And EKG is the same thing. It's just that cardia in English starts with a C, while the word cardia in German starts with a K. So ECG and EKG, it's the same thing. And this is simply a measure of what the muscle in the heart is doing. It's reflecting the electrical activity of heart muscle. And so, for example, the atria, they are involved first in the cardiac cycle. And so the P wave is when they begin, that's what's called depolarizing. The QRS complex is when they end. Meanwhile, the ventricles, the big chambers of the heart, they're involved in the second half of the cardiac cycle. So the QRS complex is where they begin, and the end of the ECG, the T wave, that's where their activity ends in the repolarization. Now, if this is, just a simple introduction for, a non-major, it isn't, perhaps best at this moment to go through all of the parts of the cardiac cycle, because there's a lot to focus on at one time. The electricity, the valves are opening or closing, what the volume of the ventricles is. So the cardiac cycle is kind of complex, and I have plenty of videos on it if you're interested. But for an introductory purpose, this may not be the most appropriate level of detail. But I did want to just mention that the ECG is this wonderful tool, because in olden days, a term was used sometimes called exploratory surgery. Exploratory surgery essentially meant, you said your head hurt, your stomach hurt, and your doctor said, well, your head feels okay, it looks okay. Come in on Tuesday, I'll cut you open, I'll poke around and see what I can see. That's obviously not the best way for medicine. And so when you can get information about your patient in a non-invasive way, that's obviously best. So to get an ECG, you can just put little electrical leads on your ankles and wrists, or maybe add a few chest leads if this is a stress test. And then as a result, you're getting a measure from inside your body of how your heart is working. And you might notice, well, I see something that's a little atypical. I see an enlarged P wave. That means the atria is larger than it normally is, than you find in normal people. Why is that? Might it be a narrow valve? Might it be, you might be an athlete, but in any case, you're learning about your patient in a non-invasive way. Once you know that there's this interval, it's about this long. If you see any abnormalities here, like if it's longer than it should be, maybe you've had heart attacks before and now there's scar tissue in the heart, which is interfering with the passage of messages here. Maybe sometimes the atria get a message and have a P wave, but the ventricles don't get a QRS message because the scar tissue has blocked that message. Sometimes the QRS complex looks off. So for example, the R wave might be taller than normal if, say, one was having a heart attack. The ST, so here's an enlarged R wave. This section here, the ST segment, that could be elevated if someone was having a severe heart attack. Now, obviously, this is good to know because some people think they're having a heart attack when they're not. And some people think, oh, I'm just tired. There's a flu going around. I don't feel quite right. But actually, they're having a heart attack. So you would want that the EMTs have a way of distinguishing between a heart attack versus not. A depressed T wave, notice this T wave isn't as high as it normally is. That could mean that you have plaques in your heart, which is limiting blood flow. So you're not having a heart attack now, but one could happen soon because your blood vessels, which should look like this, now look like that. And so ECGs are just this wonderful tool telling you how your heart is doing that can indicate, the presence of scar tissue from previous heart attacks, the narrowing of valves, when a heart attack is occurring, and a bunch of other things. So, it's a very important measure to get these done. Very often stress tests are done, that they are done with physical exertion. And the reason is, if I have an abnormality or a problem with my heart, it might not manifest itself at rest. So at rest, I might look fine. But if I were then to go out and do heavy exertion, then I would manifest the problem. So if you were getting ECG done, with a stress test like jogging or something, that might show problems that you might not otherwise see. There is certainly much more to the heart and to the cardiac cycle, but I'm going to move on. Just, another topic is the heart is not just a pump, it's a smart pump. It can regulate the amount of blood and the blood pressure which is being generated based on your body's needs. And so, there are phenomena which can increase heart rate and decrease heart rate and increase, the strength at which the heart contracts and not. And so, there's, more topics that one could cover in a heart chapter. Just very quickly, if blood is the fluid which is being pumped and the heart is the pump, then the final part of the cardiovascular system then is the vessels through which blood travels, the blood vessels. The larger blood vessels come in two categories, the arteries and the veins. The arteries have a thicker wall, which is why veins collapse, and arteries don't. The wall has muscle in it. All right, now it's involuntary muscle. You don't have voluntary control over this. But the muscle of your blood vessels can squeeze, and that can both increase blood pressure and limit blood flow to an area, and then it can dilate, which would then allow more blood to go to an area and lower blood pressure. And so we have these blood vessels, and we have reflexes, which determine the muscle, squeezing, doing what's called vasoconstriction, or dilating and doing vasodilation. When I said that there were arteries, there are actually different kinds of arteries. One type has elastic connective tissue. These are the ones closer to the heart, and because the heart wall's a little thinner, they're a bit more prone to aneurysm. And then there are those which have little elastic connective tissue and instead have smooth muscle. So here you can see an artery versus a vein. Notice how much thicker the wall of the artery was. Um, and notice that the artery had a lot of smooth muscle. And so once blood, say, leaves the left ventricle, it will travel through these elastic arteries and then through muscular arteries and then into smaller and smaller vessels, because our blood vessels, they become smaller and then become ultimately microscopic in size. There are microscopic arterioles, and then capillary beds, and then venules, microscopic veins, and then the veins, which will then return blood to the left ventricle. So there is this pathway throughout the body. Here you can see how small blood vessels can get. So they keep branching and branching and branching, forming small arteries known as arterioles and small veins known as venules. Even though many of your blood vessels are microscopic, you have so many blood vessels in your body that if you were to line them all up, they could actually wrap around planet Earth more than 2 times. So we have an incredible number of blood vessels in our body. Most of our body cells are less than a millimeter from a blood vessel. The smallest of them are called capillaries, and they don't exist singly. They exist in these capillary beds. And they're very important because this is where oxygen leaves to go supply oxygen to the surrounding cells. This is where their carbon dioxide comes in. This is where sugar and amino acids and waste go back and forth. So capillaries very often don't get the attention, say, that the heart does. But the capillaries are actually the reason to have a cardiovascular system. The heart's job is to get blood here so that there can be an exchange between the blood and the body's tissues. And so I had said a primary function of the cardiovascular system is transport. And there's lots of things which are then being transported to capillary beds or from capillary beds elsewhere in the body. The last point is that veins have a problem of how to get blood back to the heart, given that they don't have as much pressure, close to zero. And one of the things that they have are valves. So if blood tries to go the wrong way, say down to your feet, these valves close so that blood can't go the wrong way. And in our legs or elsewhere in our body, our skeletal muscles can contract and help to provide the pressure which pushes the blood onwards. So veins have valves. So there are so many other topics in the cardiovascular system. We could talk about neural reflexes and hormones, which affect the vasoconstriction of the muscle and the dilation. Once again, so many other topics. But for a non-major, just trying to get some of the basics in the major functioning of the elements of the cardiovascular system. Hopefully this suffices. And my next video will go through just some of the basics of heart disease.